Could you tell something about what are the surgical options available and we can go for surgeries if we are suffering with any kind of knee pain? Those conditions, surgeries mandatory or needed?
Yeah, we have tried all the conservative methods.
Yes.
Suppose in injured knee, the ligaments are injured and there is an instability. We tried all the conservative options, but still the pain is not gone. Apart from that, instability is still going on. Then we have keyhole surgeries for ligament reconstructions. We have ligament reconstruction surgeries for kneecap maltracking. And in degenerative arthritis, where the deformities happen and the alignment has been changed, and people are unable to do their daily activities like pujas and collecting small things, going for nature calls, they are unable to do their daily activities, then that is the time we need to decide for joint replacements.
Okay.
Because joint replacement will help you in two ways. One, correcting your alignment, and at the same time, the degenerated joint has been replaced by the artificial joint, which gives a very good joint range of movements. The alignment will be corrected and they can do their daily activities. They can even drive the car, they can swim, they can walk, they can do a brisk walking. So these all things were done in severe degenerative diseases and in knee pains which are not treatable by conservative options. So lot n number of surgeries were there, but all surgeries are not needed for every patient. So surgery is always customizable. When we treat a patient, sometimes knee pains will be because of malalignment of the knee joint. In those kind of patients, we will correct the alignment.
Okay.
There are some surgeries called high tibial osteotomies. These osteotomies will correct the deformity and then that gives a good alignment and function for the knee. So when you have a knee pain which is not treatable by conservative options like non-surgical options, then your physician or your orthopedic surgeon will suggest you preserving surgeries or joint replacing surgeries or joint reconstructive surgeries. So have complete awareness of what's the problem is, what are the options non-surgically we have. If it fails, then go for surgical options. And nowadays we have a lot of technology. Whatever technology we have,
Yes.
we need to customize to that patient and undergo the surgery to get the best possible outcome.
Means final thing is that it cannot be treated with a non-surgical way. Then we can go for only surgical is the
Surgery.
only option.
Yeah,
So we can go
yeah.
for.
Because you need to increase the quality of your life.
Yes. Yes.
You can't keep on sitting just like that idle, thinking that I am done, I have no other option, I tried everything. But in this kind of new era, we have all the armamentarium from pills to surgery.
Yes.
Where you fit in, we don't know. We start with physical therapy, with mild analgesics to relieve your pain, do regular exercises. If it is cured, then it is fine. If it doesn't, then you go to the next cycle.
Yes.
Then surgical options will come. For surgical options, we have different set of modalities. Choose the best one, talk to your physician, and then go ahead.